Hi Helen, so you are our Clinical Director of Acute Medicine and also the OPAT service. Do you want to tell us a little bit about how OPAT functions here, and especially the spotlight that's on it at the minute with it being the Same Day Emergency Care PDSA week?
Okay, so our OPAT clinic here, so OPAT as you know is outpatient antimicrobial therapy, focuses on intravenous antibiotics given in the patient's home, occasionally here in clinic, but ultimately on an outpatient basis. And we've got the advantage here at Warwick that we are located in the ambulatory emergency care SDEC area, which means as well as facilitating early discharges from the wards, we can also do a lot of admission avoidance. So we take referrals directly from GPs, often via the GP liaison team, from ambulatory and from ED, because we're closely located to all of those. So often we can avoid patients ever needing to come into hospital. We're a small team, we are very ACP led, and we've got some really experienced advanced practitioners, which we're really lucky to have. And one of the ways that we have tried to utilise the skills in our team as best as possible is we created a RAG rating, red, amber, green. So red patients are the more complex patients that take a lot of consultant time and they're always consultant led. Amber patients are the less complex patients who can be looked after by our experienced ACPs. And then the green patients can be nurse-led patients. That's generally things like cellulitis, and we've got some really experienced nurses who's been with us for years who can manage those patients independently. And it doesn't mean that the amber and green patients never see a consultant. It means that if the nurse or ACP feels happy and competent to make a decision, they can, but they've always got consultant backup. And it means that for the majority of those patients, they look after them, and the consultant time can be focused on getting some of the more complex patients out of hospital.
So that's great. So that obviously enables you to flex the capacity you've got within the team,
Yes.
and see what next patient on the waiting list can come through.
Yeah, and it means that we never really close. So even when we're very busy and we've got a lot of patients, we never really close. We just look at the skill mix that we've got, and perhaps, okay, we might not be able to take a red patient at the moment, but we can always take greens. That plus the self-administration training that we do means that we're constantly trying to optimise the number of patients that can benefit from the service, even if we're not in a position to expand the service. So the other thing that we do is we have a real focus on training either patients, a carer, a family member to do the antibiotic administration, and that frees up our nurses for the patients who can't. And we have a standard that we work to, which is that at least 50% of patients should be self-admin patients. And we generally are at about 60 to 70%, so we do really well, and the nurses work really hard to facilitate that as well.
And I know you've got some great stories of patients that have had IV therapy at home for 12 months and kept them out of the bed base, and the outputs from the OPAT team. Can you tell us a bit about that?
So we tend to look after between 250 and 300 patients a year. We have 40 to 50 patients on the service at any one time, and they vary anything from 1 or 2 days to we've had patients for 12, 18 months. I think our last 12-month figures, we saved the equivalent of 37 bed equivalents, which is almost 2 inpatient wards. And considering the costs associated with OPAT are about a third of inpatient costs, that's a really significant cost saving for the trust. But it's also really significant for those patients as well. The patients who are on IVs for 1 or 2 days get to go home, but some of these patients who are 6 weeks, 12 weeks, 6 months, they get to live a relatively normal life. We have patients who are working with their line-in, doing their own antibiotics, just coming to clinic once a week. And even for the patients who are still at home or home-based, they're not having to wait. We can give them a 2-hour window for a nurse visit, or their family member can do their antibiotics and then they're free for the rest of the day. So it's a big difference to somebody's quality of life, I think, if they're going to be on a long course of antibiotics, to be able to have that at home.
And that's great for patient experience as well, isn't it? So that sounds a fantastic service. If you had your idea of developing it further, where do you think you'd like to go next? I know we've touched on care home patients, haven't we, very briefly in a short PDSA?
Yeah. We'd really like to be able to go into care homes and assess those patients in the care home. At the moment, those patients come to us, we assess them, we work with the excellent frailty team to get them out as quickly as possible. but I would really like for those patients to never have to come in. So if we had enough of us to be able to go out there, do that assessment, put the line in, start the antibiotics, that's one big area we'd like to focus on. And the other is just being able to get people out even quicker. You know, occasionally we do have patients who, you know, we can't get them out today, we can get them out in 2 days, 3 days. You know, I'd like to be able to get them out as soon as they are well enough to be at home.
And it is a gold standard service. You must be very proud of what you've set up, and the team are brilliant.
Yeah, and we're really lucky here. We've got a really good team. We've got really good staff retention, which means the team's experience is always increasing, and that really helps with the red, amber, green as well, because, you know, our nurses are almost at the point where they could manage the amber patients because they've been with us for so long. And we've got, you know, we compare ourselves to other services. At the moment, 99% of our OPAT patients meet their intended clinical outcome, which is really good comparatively against all of the other local services. And for a relatively small trust in comparison to some other OPAT services, we take huge numbers of patients, so proportionally we take a lot more patients than even some of the bigger OPAT services.
And that's great because you've got a real mixed background within the team, haven't you?
We do, yeah, and we're really lucky with that. So, you know, our ACPs are nursing and pharmacy, which you couldn't ask for better in OPAT, and our nurses are from a real mix of backgrounds and all really useful for OPAT: diabetes, orthopaedics, neurosurgery, respiratory, and that's great because, you know, everybody adds something to the team, and there are, you know, everybody's skills are recognised and utilised, and I don't think there's a specific hierarchy. You know, if we've got a nurse who spent a long time working on orthopaedics, her opinion counts compared to somebody that's never done orthopaedics. So, you know, they're a great team, and I hope that we can keep them and build on them.
Absolutely. And if I said to you what are you most proud of the OPAT service, what do you think you'd say?
I think I'd say the team and the way the team all work together, and the fact that, you know, as a team they are constantly saying, how can we do more with what we've got? They never just say, well, do you know what, we're at capacity, that's that. They're very conscious that there are patients waiting to come onto the service, and so they're always coming up with ideas. I think we could do this, I think we could do that, I think we could cut down the number of times these patients come, and that gives us a bit of capacity for another group of patients. So, you know, as a team, they're so keen to build and do more, and really enthusiastic about what we do as well.
That's great. Thank you so much, and do thank the team for everything they do.